Hello, my name is Rosalind Person, and this is a video for Assessment 1 on collaborating and leadership reflection. So, part 1, we are going to talk about the lean process, which is something that is done at my urgent care. It's when we do a process of pulling to your full. If triage is running and they're busy, but we have empty rooms in the back, then we go ahead and grab the patient and triage them in the back. We have scales in the back, all the supplies we need, and we'll triage them in the room. Now, this, when it works, this is absolutely efficient. The doctor can come in, see the patient. We're able to evaluate them faster. Our turnaround times are quicker. We're getting out of there in a timely manner. So we see all patients until the doors are closed. Once the doors are closed, we see everybody until they're all seen. So we have been there as late as 2 o'clock in the morning. Sometimes we'll even get out at 9:30 because we close at 9. So that can happen. It just depends on the continuity and how things are running. So when it works, we're moving. We're seeing the patients. We're able to triage the emergent patients, the respiratory distress kids, because we're pulling from the list and assessing people faster and basically pulling to your full. And that is what the lean process is. So when it works, it works. Now, when it doesn't work, is when we started this process, we explained the whole process, went over it at a nursing staff meeting. Because everybody was not present, there was no real follow-up that says, hey, this is what we're doing, this is what's going on. And because we have a variation in leadership, and some leadership is more assertive than others, some of them are more motivating to keep people moving, some of them have issues with distraction, so you're not 100% on your job, so it's hard for you to be on people, and then the doctors are complaining because they want to know, okay, so I got 2 empty rooms, you're increasing our TAT times, which is our turnaround times. And so as a result, then there's a little bit of frustration and work is not being done. We end up being there later because the people are not triaged faster. Then there's a train wreck out there that we didn't see till an hour in. Now we're waiting 2 hours for transport. Now, had we pulled till we full and got the ones that are in respiratory distress and emergent patients quicker, then that wouldn't have happened. Now, what should have happened in this lean process when it first got started, we should have went ahead and sent out a template, a PowerPoint of what we needed to be done. And this is what the lean process is. This is how it goes. Please send a confirmation email to make sure every nurse has it. Sent to everybody, even the ones that were present. So that way we're holding everyone accountable for what they're supposed to be doing. And in doing so, there's teamwork that is in support of leadership and all staff that is involved in this lean process. And in doing so, everybody is on the same page. And then if you have questions, you can talk to your assistant nurse manager, supervisor, or the charge nurse on your actual shift. So when that's done, everybody's on the same page, keeping the continuity of care and the flow going. Turnaround times are faster and everyone is moving along. And that's what should have happened. We're in the process of implementing a reassessment and a revision of that. So that way we can all be on the same page. Now, the second reflective occurrence was in evaluating as a safety officer in various nursing homes in a specific chain. And what is being evaluated is referrals and when referrals have to be done and outside sourcing needs to be requested. So during that process, the doctor does an order. The nurse that is responsible for that patient looks at all the orders. If a referral needs to be sent out and somebody needs to be evaluated, say to get an outpatient x-ray, so x-ray can come in and do that. For podiatry to come in, maybe dietary needs to come down and reassess them to see what they're actually allowed to have because they're no longer on liquid diet. They need to do a swallow eval, so OTPT needs to evaluate them. So those orders are done. So then that referral is sent to them. You call them, you make a referral, they come out, they assess, or they come down if they're in the facility and assess them and go from there. So when that's done, their services are being given in a timely manner, and patients are getting their diabetic care being done. They're in a proper diet, x-rays to determine if something is broken, seeing if there's a bowel obstruction and different things like that. So they're getting increased care, and that's being productively done. However, what tends to happen when this process is not working is that you do a consult, a referral. You make the phone call, you let them know. So I do that as the 3 o'clock nurse. Then the next nurse comes on at 11, and there's nothing in report that a consult is even done. Orders are signed off that I've made the call, but there's no note to follow up to say that this is what's going on. So then the third shift nurse, they're not going to call anybody. First shift doesn't know that it wasn't done, so everybody just moves around. So now we've gone 1 to 2 days that a consult has not been verified. Did they even make the call, or did you just sign off on it? Because there's no documentation. Now what should happen is that information should be in the report. If it's not been resolved, it will remain in the report to the oncoming shift and ongoing as a follow-up, so the next day shift can call and say, hey, I called in the consult yesterday trying to find out when you guys are coming out. And in doing that collaborative of care, you're having teamwork, because everybody is working together with all the disciplines, the doctor, the nurse, dietary, podiatry, x-ray, radiology, OT, PT, whoever the consult is for. So that way everybody is following up and knows what they need to be doing for the patient. That is understanding the plan of care. That's addressing all the concerns. Team communication. Everyone knows what everything is being done, and everyone is aware of the plan of care. It makes us efficient. And then when the family says, okay, so they told me about doing a consult about her feet. What did podiatry say? I don't know, because there's no documentation. I don't even know if they was called. That can be prevented. That makes customer service satisfaction to be low, because we're not accommodating and using our interdisciplinary skills to be able to make sure that we're communicating together. And that's also in leadership. That affects the charge nurse. So the unit manager needs to follow up and make sure that that's done. So when you do it, document it. So when somebody looks in the chart and sees, okay, the consult was done, let me follow up and see if they scheduled something. Okay, they didn't, then I'm documenting what I did. And then there's a paper trail, whether it's electronic, whether it's on the report sheet, or whether it's in the patient's chart, but there's a follow-up on what's actually being done. So you see what the process is. And when it works, care is being done, consults are done, referrals are happening. When it doesn't, we're dropping the ball and patient care is being delayed. That is costing, because now something that could be remedied is now worsened because follow-up wasn't done. There could be an aspiration and causing more healthcare issues, causing increased care cost to the family, to the facility, to the patient as a result. So in doing things in a timely manner, we're cutting costs. We're not using excessive resources, and we're using our resources wisely to help our patient. And in conclusion, when it comes to interdisciplinary, we have to have teamwork. We have to have communication. We have to understand the plan of care. It has to be continued to be reviewed and evaluated. We can't assume what happened last week is the same this week, because in long-term care, it is not that case. In any aspect of healthcare, it changes from day to day. So there has to be team communication, from the doctors to the nurses to any referrals or consults that are done, making this interdisciplinary communication team effective. And then that way we're able to follow up with the family. They don't have to ask, because we already followed up. That makes us efficient. That keeps patient safety and increases patient satisfaction. Thank you.